Today, we are going to talk about diabetes in kids. Have you ever heard about childhood diabetes? Do you know, children can get diabetes as well?
Let's look at the current status or diabetes rate in children, including teenage or under 20 years. Worldwide, the childhood diabetes increasing over the years. In United States, around 210,000 children and teenagers under the age of 20 years have been diagnosed with diabetes until the year 2020. While in Malaysia, around 7,928 children and teenagers under the age of 20 years have been diagnosed with diabetes.
There are different types of childhood diabetes. Type 1 and Type 2 diabetes. The Type 1 diabetes happens when the body, specifically pancreas, unable or could not produce a substance called insulin. Do you know why insulin is important for the body? Stay tuned with us.
Glucose from the food that we eat will be absorbed into the bloodstream. The bloodstream will send a signal to the pancreas to take the glucose from the bloodstream. In normal condition, the pancreas will respond by producing insulin. However, individuals with type 1 diabetes, the pancreas could not produce insulin. The insulin will signal the cells in the body to take the glucose from the bloodstream and open the bloodstream door for the glucose to go out. While for type 1 diabetes individual, the glucose remains in the bloodstream, leading to increase in blood glucose level.
Now you know, insulin is important for the body because it helps to maintain sugar levels in the bloodstream. The average age of diagnosis of type 1 diabetes is 13 years old. The common symptoms of type 1 diabetes are: need to pee a lot, be thirstier, drink more than usual, feel tired often, and lose weight. If your kids shows any of the symptoms, please refer to the nearby clinic or doctor. Treatment for type 1 diabetes are: taking insulin by injection or an insulin pump, eat a healthy, balanced diet that includes counting carbohydrates, check blood sugar levels at least 4 times a day, and get regular physical activity.
Now, let's move on type 2 diabetes. Type 2 diabetes is a condition where the cells in the body do not respond to the insulin to absorb glucose from the bloodstream.
In normal condition, as mentioned previously, insulin will signal the cells in the body to take the glucose from the bloodstream and open the bloodstream door for the glucose to go out. However, in type 2 diabetes individual, the cells do not respond to insulin. Therefore, the glucose remained in the bloodstream, leading to high blood sugar level.
Type 2 diabetes is diagnosed at age between 2 to 19 years. Symptoms of type 2 diabetes are: need to pee a lot, be thirstier, drink more than usual, feel tired often, lose weight, blurry vision, and darkened areas of skin, neck or armpits. While the treatments are: take medication and insulin jab, get regular physical activity, weight loss surgery, but not for everyone, eat a healthy and balanced diet. The type 2 diabetes rates increase along with increases in childhood obesity.
What is obesity? Child with obesity is described to has excess weight or body fat, has high body mass index, BMI, and has the risk of developing a number of other health conditions, including metabolic syndrome, arthritis, and some types of cancer. Items that tend to increase the risk of weight gain includes foods, as fast foods, fried foods, processed meats, and many dairy products, foods with added sugar. The less a person moves around, the fewer calories they burn, so easy to weight gain. Sleep deprivation significantly increase the risk of obesity in both adults and children. When a person does not sleep enough, their body produces ghrelin, a hormone that stimulates appetite and reduces the production of leptin, hormone that suppresses appetite. Some medications can also cause people to gain weight over a period of months.
Diabetes can cause complication or other related disease in the future if it not treated and managed. Few of it are heart and blood vessel disease. For example, narrowed blood vessels, high blood pressure, heart disease and stroke. Nerve damage. Excess sugar can injure the walls of the tiny blood vessels that nourish your child's nerves. This can cause tingling, numbness, burning or pain. Kidney damage. Diabetes can damage the numerous tiny blood vessel clusters that filter waste from the blood. Eye damage. Diabetes can damage the blood vessels of the retina, which may lead to vision problems. Osteoporosis. Diabetes may lead to lower than normal bone mineral density, increasing your child's risk of osteoporosis as an adult.
Together, let's bring up healthy kids.